Hello, good evening, everyone. Can everyone hear me all right? Can you hear me okay, Russ?
I can hear you fine, yeah.
Excellent. So, welcome, everyone. Thank you for attending this session. This is the PLAB 2 mocks that's being conducted by myself and Russ as just a moderator. Just a little introduction about ourselves. So my name is Dennis. I'm one of the F1's foundation trainees working in Portsmouth General Hospital. And just a little background myself, I've passed PLABs recently, and quite fortunately, I've passed all the stations, 16 of them. And I've got a few stations I've got a full marks in. So I'm kind of confident that I know what to do around PLAB 2 in terms of what they are expecting and what they are asking for. So I will explain a little bit more later, and I will pass the introduction to Razaz, who is our moderator.
Hi everyone, my name is Razaz. Some of you may know me from previous IMG series webinars. I'm here on this mainly as a patient for Dennis, really. I am a GMC PLAB examiner, so I'm not actually allowed to do anything else. I'm only going to be a patient for him and to facilitate this session for him, and for all of you to benefit from this, of course.
All right. Thank you, Razaz. So we've received an overwhelming response of they've got a lot of questions around time management and clinical management, which I understand a lot of people struggle in. So I'm going to start this session with just giving you a few tips around how to manage your times in 8 minutes, because it's quite a short time and lots of people struggle with that. And the other one would be clinical management. So later it will be followed by 3 mocks, which Razaz is gonna be the patients, and one of you could kindly volunteer. I think it's really good practice. If you are able to practice and in an audience of probably 10 patients, it's gonna calm down your nerve and you'll perform better during the exam. So later, if anyone's interested to be a volunteer, you can just let us know in the comments. So I will start with time management. There's a few tips really about how the most important way to manage time. And we'll start with just a very basic introduction, I would say. Because when you go into the exams, you're under a very stressful environment. It's very normal for anyone to just doubt themselves and forget the simplest sentence. So I would strongly advise memorize your names, your GMC number. So whenever you go into the room, the timer starts straight away. So you want to save every single seconds on every tiniest details as well. So if you go into the stations, the examiner is going to be set in front of you. Just go straight to him, give them your name. For example, my name is Shyun Tiong, and give them the GMC number straight away. So it would be really helpful if you could memorize the GMC number and then proceed to sit down. It would be quite nice if you ask the patients, may I sit down? Just the simple things. So you'll be scrutinized at every single aspect once you enter the room, essentially. So when you sit down, because 16 stations, you will be faced with different examiners. So what would really help is to memorize your introduction. So I'm going to start with an example, just a simple example. Sit down. Hello, my name is Dennis. I'm one of the junior doctors in this GP surgery on this ward. Can I please check your name? How would you like me to call you? So it's just this simple thing that actually help you to save time, because a lot of people, it's only humans' nature to get nervous when you go in and you start to forget your own name, for example. It's quite commonly seen. So just memorize every single sentence in your introduction. Go in. Hi, my name is Dennis. I'm one of the junior doctors here. How can I call you? Or can I please check your name or your dates of birth? How would you like me to call you? Then very nice to meet you. How can I help you today? Just 3 simple sentences will save you about 15-20 seconds, and you can ask a little bit more around history taking and your management. The second thing I'm going to say is investigations. It's because it's going to be quite similar in every stations. So when you say, so I'm just going to do some examinations on you, if that's okay. You can memorize these sentences very easily. It doesn't have to be, the reason that I want to do this session is I don't want everyone to be scripted, because everyone attend academy nowadays, and hence there's a reason why there's a higher rate of failure, because everyone's literally go in, say the same thing, and the examiner, they will be examining hundreds of students every day. So they just kind of know that what they're expecting. So it's not as interesting enough to them. So if you just can twist your sentence ever so slightly, like, can I examine you quickly, please? I'm just going to perform examinations on you, if that's okay. So I'll be doing your blood observations, for example, your blood pressure, heart rate, respiratory rate, temperature, and your oxygen saturations. Then I'll be examining you quickly by having a listen, having a few of your, for example, of your respiratory system, of your chest, if that's okay. Simple as that, nothing else. For other investigations, if you don't ask, you don't get. As simple as that. So if the case sounds quite cynical, like a pneumonia case, if you don't ask for chest x-ray, you're not going to get the chest x-ray, and you're not going to pass the exams, because even though you know it's quite clearly a pneumonia case, they know that everyone's gone through all the scenarios. So when you're nervous, you start forgetting things. So you, in your mind, you'll be quite sad, like, this is pneumonia case, this is an ACA's case, I know this. But you still have to ask for every single investigations, if that makes sense. All right. And management, I can't stress this enough. A lot of people I know a lot of people have experienced a lot of clinical experience as an IMGs overseas. So you know lots of complex management. But the idea behind PLAB 2 exam is just very simple. How to be a junior doctor in NHS, how to be a safe doctor, as simple as that. So we don't want you to come up with brilliant management, just a simple thing, symptomatic management. I'll give you some painkillers for your pain. I'll give you some antibiotics, and I'll give you some just basic management that you don't, I'll give you some anti-nauseous medications to help ease your nauseous. That's all. And in the end, as long as you say, I'm going to have a quick chat with my senior to make sure that he's happy with my plan. Is that okay with you? Very simple sentence with the patients, and it has to be patient-centered as well, which I will cover later in the session when we're doing the case. All right? Always read prompt before you start your exams. You're given 1 minute and 30 seconds to stand outside the stations. A lot of people don't know what to do with their time, so they just started looking around. Just look at other people, what other people are doing, and it makes you more nervous. So what I did, which I find really helpful, was I would go through in my mind, for example, the prompt that says patient will present with a chest pain. So just have in your mind, just formulate those questions, what you're going to do. Like, for example, so the pain stations, go through Socrates, every single bits of chest pain, what DDX can be, as simple as that. And in terms of differential diagnosis, a lot of people also struggle with how many differential diagnoses that you actually need to give. So you started asking more and more questions around history taking before you realize time is up, you haven't gone into investigations or management, and then you fail the stations. So it's not rocket science. 2 to 3 red flag symptoms sentence that you have to ask. For example, for chest pain scenario, for the differential diagnosis, what can it be? The simple one, pneumonia, pulmonary embolism, or pericarditis. Just ask any pain while you're leaning forward. That's your one question's done. Any new cough that you have got? Is the pain worse when you're breathing in? Or do you have any travel history? Have you been anywhere else? Have you traveled on the plane or on the long distance recently? Then that's it. It's covered. So in terms of your history taking, you're going to get a really good score once you've managed to cover all of these things. Secondly, for clinical management, it's 4 points as well. So it's as important as your history taking. For example, if you manage to ask all the questions, but you didn't have time to get into management, what if you're gonna get 3 maximum because you didn't get into management, you didn't get into diagnosis. They don't know what you're asking for. So they don't know what the diagnosis is. So it doesn't matter what you come up with, what investigations, what brilliant management you come up with, you're not gonna get any marks. It's as simple as that. So PLAB 2 is more like a ticking boxes kind of exams. You just have to be yourself. You have to come up with your own sentence as well, if that makes sense. So I know there's a lot of academy that will give you scripted textbook, hundreds of pages. You can read them, but you still have to formulate your own sentence. I mean, they're really helpful in terms of what you need to ask, the main thing you need to ask, and the investigations and management as well. But you just essentially have to be yourself, be a safe doctor, and you're going to pass that exams. It's not a really difficult exams. I know a lot of people will think of it as a really tough exam where you have to be perfect. You don't. 8 marks is a pass, 12 marks is a pass. Once you cover those basic things, you will be able to pass. So any questions so far that I'd be happy to answer? If not, we can move into the stations and I'll give more feedback around each station. So we're going to do 3 stations today, essentially. First one is going to be focused on history taking, where it's going to be quite a long case, and you try to do time management. I would do quite similar to the exams, where you will be given 1 minute 30 seconds to go through the prompt, formulate what you want to ask, what is the differential that you're going to do, and then you come up with the investigations and management. Because this is a first session, so I'm not going to do a really tricky case. I'm just going to go with basic. And second station, because of a lot of suggestion that comes in that people struggle with psychiatry stations because it involves heavily on interpersonal skill and your communication skill. So you just have to be empathetic towards the patients, which I'm quite lucky that I thrive in because I've done elective in this country and I've shadowed a lot of consultants and I pick a few sentences from each of them and kind of store it in my own dictionary and use it when time comes. And the third station is going to be Singman. So instead of doing these stations like an exams, what I'm gonna do is Razaz is gonna be the patients, but I will let you know what you would be expecting. But I want you to perform the stations like how you would during the exams. Ignore me, ignore the examiner, but I'm gonna tell you what to do. But I want you to speak to the patients like what you would do in the Singman stations. All right. So let me just go through the questions. So differential diagnosis, like I've explained, 2 to 3 maximum, but I will go with the red flag symptoms. What is the most important things? Patient come in with palpitations. What you need to rule out is hyperthyroidism or any arrhythmia. So you have to do chest ECG. So it's just a basic. Chest pain, Socrates, any other symptoms. If pains, go with Socrates. Any other symptoms, go with the OD para. So just when did it start? How did it start? Anything make it better? Anything make it worse? So I'm sure everyone has gone through these basic things. So I just want you to focus on the red flag sentence, like any weight loss is important. If you have a cough, did you notice any blood when you cough? Did you manage to spit out any sputum? All right. We've got questions about social stuff like the living conditions, skin scenario. So again, it relies heavily on the prompt. If the prompt say, please take focus history and give a diagnosis and management. In that case, this station is gonna be quite a balanced, spread out history taking stations. So you just have to go through quickly. If it's indicated us, If it's not indicated, you don't have to ask. For example, if it's a skin scenario, it's important to ask about exposure, ask about their living conditions, family history, but it's not that important to ask about, for example, do you have any pain? Or pain is important, discharge is important, but it's not important to ask more about past medical history, if that makes sense. So you don't have to keep going round and round and round about questions that is not important. So yeah, I have a question to always address ideas, concerns, and expectations. So I know this ICE has been overly talked about in PLAB 2 exams, where a lot of academy they will tell you must do ICE. I've seen a lot of candidates that would do ICE, but they will start with any ideas what you have, what's your concern, what are you expecting from us? That's it. But the examiners going to know that the interpersonal skill of this person isn't from the bottom of the heart. So in terms of ideas, you can very simply just ask them after you ask, or after the history taking, after investigations, just a simple sentence. So you come in today with these symptoms. Any idea what you might have? That's it. So you don't have to go straight into concerns. You can spread them out through the whole case. It's something that you have to adapt and learn when you're practicing with your study partner. So if they look concerned, if they frown their face like this, there will be concerns like, you look a bit concerning, anything that I can help you with? Or you can just stop, pause in the middle of the stations. If they look, you have to look at the facial expression as well. So it's not just about what you say, about how your body language with the patients, like if you are sincere. So body language is part of the interpersonal skill. So another thing, before you go into investigation, you can spread them out. Say, oh, since you come into, if it's in the GP station, since you come and see us today, are you expecting anything in particular from us? Or anything specific that I can help you with? So that's it. Your eyes is covered. The examiner is going to look at you. Wow, these candidates know their eyes, knows their interpersonal skill, know what they are doing. So you will score in interpersonal skill rather than just saying, I'm sorry at every single thing that they say. Oh, I'm in pain, doctor. I'm sorry to hear about that. If you're not sorry, don't say it. As simple as that. What do you say in a situation where you can't answer the patient or unsure some? You can be sincerely honest because you're just a junior doctor. We're not expected to know everything. Just say, unfortunately, I don't have the answers to your questions, but I will just speak to my seniors and will get back to you. Is that okay? Just ask the patients. It's more of a communications exam rather than just a full-on clinical management exams, if that makes sense.
Yeah, and you do that in real life. If that was a patient actually in front of you and you didn't know the answer, you would say that, oh, I'll just check with my seniors. I'll come back to you in a minute. There's no shame in that. We don't know everything.
Yeah. So you don't need to know everything. Even the consultants, you will see them on the rounds. When patients ask them a question, they will say, oh, I'm sorry, but I don't know the answer to these questions, but let me speak to my colleagues and we'll come back. Or let me find out a little bit more information on that and they'll come back to you. Just as simple as that. All right?
Yeah.
And how do I ask intimate questions like sexual partners and sexual activities? So it depends. You don't have to make it awkward. Like if you are awkward yourself, the patient is going to be awkward. The vibe in the room is going to change. Just say, so because you can just ask simple questions like, I'll be asking a few sensitive questions. If you feel uncomfortable, let me know and I will stop. That's it. And you carry on asking intimate questions. You are in an exam. Patients knows that you are the doctor. So they will expect you to ask these questions. Of course, you don't ask in every single case. If it's a quite obvious STD case, then you can ask those things. As HIV case, you can ask those things. If it's a chest pain, you don't have to ask sexual partner or sexual activity. All right? With half an hour into our session, so I'm going to go into I'm going to go into the cases. So anyone who wants to be a volunteer?
Yes, I think I'm the first one.
All right. So just a little housekeeping before the stations. I'm going to do it like exactly like in the PLAB 2 exam, where you will hear this bell.
Begin.
So the first bell, it means begin.
Enter the room.
Sorry. Begin means you go to the station, stand in front of it. You have got 1 minute, 30 seconds to read the prompt. I want you to utilize it. Think what you want to ask. Think about differential diagnosis. Think about investigations. And then you go into the station. So when the 1 minute, 30 seconds is up, it's going to be like this.
Begin. Enter the room.
It's going to be enter the room. Then you go into the room. Timer starts straight away. So every single second matters.
Okay, so shall I also like read the examiner as if I'm in the station, or?
So I will be the examiner.
Okay.
So you can speak to me, tell me your name, your GMC number, and then Razaz will be your patient. So you need to start talking to her.
Right. Okay.
Any questions?
Maybe don't tell your GMC number.
Yeah,
No,
maybe
I'll
not
just,
GMC number. You can just make one up.
yeah, just one random one. So where can you see this
Okay.
the script? Where I mean the task?
It will be on the screen, so you can have a read. Are you ready?
Yes.
All right. Good luck.
Begin.
Right. Hello. Mrs. Anastasia Borgunova, GMC number 1325610. So, I can't see the patient, sorry.
You can start now.
Okay, yes, thank you. So, hello, I'm Dr. Borgunova. I was called to have a little chat with you. Are you Mr. Harry Smith?
Yeah, I'm Mr. Smith.
All right. May I ask you, how can I help?
Well, I've just got this cough, you know. I've had it for such a long time now.
Right, okay. So, what I'd like to do is, I would like to look at the monitor, please, to check the vital signs. So, I would like first to check his oxygen saturation and any what's the sorry, can I just check? Okay, thank you very much. Right. So, all right. How would you like to be called? Sorry, please.
Harry is fine.
Harry's fine. Okay. So, can I ask you? Do you have any symptoms at the moment?
I've got this cough, as I said.
Yes. Sorry. Okay. Right. So I can see that your oxygen saturation is a little bit low. So, can I ask you if you have COPD or smoker's cough?
Well, I've been smoking for a long time, so I suppose that's yes.
Okay. Do you have any medical problems?
I'm diabetic and hypertensive.
Okay. So what I'd like to do is I would like to give my patients an oxygen mask, wear a resin mask with a type of saturation 94, 98%. And I'd also like to check the chest X-ray. If I can have a look. And thank you very much. Okay, right. Could you please show me again the vital signs? Thank you very much. Okay. So, and also what I'd like to do is I would like to take ABG twice. And as the patient is talking to me and he is alert, which means that his airways are patent. So next what I would like to do is I would like to look at the chest. Harry, that's all right?
Yes, that's fine.
All right. So I cannot appreciate any trauma, bleed, drain, or deformity. All right. So what I'm going to do is I'm going to look for a chest expansion. If you can breathe in and breathe out for me. Thank you very much. Okay, it's equal. Then I'd like to look at your windpipe. It's in central, and look for your JVP, veins, and nothing voice. And then what I'd like to do is like to tap over the chest to see if there is. Okay, then I would like to percuss your chest as well, and then I'd like to listen to your chest. And I can see that there is breathing with posterior muscles and auscultation. There are crackles on the left base. Okay. So at this point, has the saturation improved? Okay.
Yes.
Okay, complete now. Okay, thank you very much. So now what I'd like to do is I would like to check your. So what I'd like to do is I'd like to check your capillary refill. Should be I will count to 1 to 5 seconds. Should be less than 2. I'd like to check your radial passes and dorsal spiritus. Also, I'd like to check your temperature. Once again, I can see it's above the normal range with 38.5. So my patient is febrile. I would like to check the blood pressure again. It's 145 over 90. Okay. And then what I'd like to do is I'd like to have a look at your chest again and check your cardiac acts. And then I'd like to listen to your heart sounds. 4 points. Any heart murmurs?
No, heart sounds clear. First and second heart sound normal.
Okay, thank you very much. So at this point, what I'd like to do is I would like to request a 12-lead ECG, place 2 Whiteberg cannulas at cubital fossa, and request bloods for FBC, UME, LFC, CRP, and also I'd like to request blood cultures as well, and take updates, and yes, so, and also I'd like to take sputum cultures as well. Okay, so how are you feeling now, Harry?
Well, I mean, as I felt earlier, really.
Okay, right. Okay, bear with me, please. So at this point, what I'd like to do is I would like to look at your pulse, check if there is any pain or any pulse tones. Also, I would like
some pain. Yeah.
You do have some pain. Okay, which pulse then?
Oh, not in my calf, in my chest.
Just only in the chest. Okay. Does it increase when you breathe in?
Yeah.
Okay, right. So you've mentioned you've had some cough. Do you feel? Do you have any sputum with it? Any phlegm?
Some green stuff. Yeah.
It's green stuff. Okay. And how long has it been for?
2 weeks, I guess.
2 weeks. Okay, right. I see. Okay. So now what I'd like to do is I would also like to take a finger prick to check for your blood glucose as well, because you've mentioned you're diabetic, so I just like to see your sugar levels. And then I would like to take a torch and check your pupillary reflexes as well. And then I would like to request a drug cardex, please. and check your medications. And
I'm on amlodipine.
okay. And as I mentioned, I've checked the pulse. Is there any pedal edema at all?
No.
No. Okay. And would also I would like to recheck my patient's vital signs, please, at the monitor.
Vital signs improving.
Okay, thank you very much. So, Harry, what I'd like us to do is I would like to perform an examination from head to toe. So, what I'd like to do is I would like to see if there is any rashes, any swelling anywhere, any bruising, any bleeding at all. So, ideally, I would like to do this in front and at the back as well. And then I would also like to call my seniors and discuss with them our further management, if that's okay.
So what are you going to do to me?
So what I'm going to do is I would like to keep you with us for a little while, if you don't mind. I'd like to call my seniors, and what I'm going to do is I'm suspecting what you might be having is a condition which we call pneumonia. So basically, it's a chest infection.
Time's up.
So
Sorry.
thank you very much.
Thank you, Anastasia.
Thank you very much.
Thank you.
I do apologize. It's not exact. We haven't actually. We're very clear about what this station is. This is supposed to be a history-taking station, but you've made it into a Siemens station, which I think you did it very well.
I thought it was a
If it's a
Siemens
Siemens,
because I think you mentioned it was a Siemens first station, no?
sorry, the first station would be history taking, but I mean, in all fairness, you did very well for a Siemens station.
Yeah, I thought it was Siemens. Sorry.
But yeah, it's all right. But you did very well for a Siemens station. But I'll go through the Siemens stations later in a bit more about how to be systematic. But in terms of these stations, we can just speak. This is just a study group, so you can just interact with us. In terms of these stations, what would you focus on?
Yeah, so if it's a history-taking station that we would like to do, so I would like to say, I'm Dr. So-and-so, introduction, so I would like to check my patient's name and age, and greeting, then I would like to do how can I help, present a complaint, explore the complaint. If it's cough, then I would like to go with ODPARA, also duration, progression, associated symptoms, exacerbatory liver factors, and then I would move on to my red flags. I would ask a few questions there. Then I move on to general health, daily habits, about bladder movements, and then I would move on to past medical history, surgical history, medications, allergies, family history, social habits, smoking is very important, drinking, potential drugs, but not really in this case. And then I would move on to home circumstances, occupation probably as well, and obviously I would ask, are you worried about anything? Is there anything in particular that you would like us to do today? And I would want investigations. There I would check his vital signs, respiratory rate, oxygen saturation, heart rate, blood pressure, temperature. I would like to examine your chest, listen to your pulse, and then I'd like to do management, which will include requesting an ECG, X-ray if it hasn't been done, blood cultures, sputum cultures, potentially starting from antibiotics, doing painkillers, anti-nausea medications if needed, and involving my seniors.
Yes, excellent. So you've got all the grounds covered, but I've just got a few tips around stations like this. These stations essentially would be a history-taking stations as such. So when the prompt say, if you look at the prompt again, talk to the patients, take relevant history, assess the patients, discuss about initial management. So it's kind of prompt you, telling you that we just want initial management. You don't have to come up with something very extreme. I'll give you IV tazocin, but you just have to give the first line. You are in A&E, you're not going to do much. I'm sure Razaz got a lot of experience about stabilizing the patients, send them to the ward. So most importantly is history taking. In stations like this, diagnosis has to be right. So you will start with all the red flags, such as any wet loss, any night sweats, any recent travel history, because there is an oxygen requirement. So assess the patients. When you're assessing, you just say, like I told you, you can save time by just saying that I'm going to do a quick examinations on you, if that's okay. I'm going to take observations, your blood pressure, heart rate, respiratory rate, temperature, and your oxygen saturations. And they're going to give you this. You look at it, okay, fine. You just have the quick chart. Looks like it's pneumonia. Fine, we move on. I'm just going to have a quick listen to your chest. And I'm just going to examine you quickly. They're going to give you this. So on the prompt itself, if you go back, it says chest x-ray has been taken. So if you don't ask for chest x-ray, you're not going to pass. So I'm just going to have a quick look at the chest x-ray because they normally would put it in front of the table. So bear with me a second. I'm just going to look at the chest x-ray in front of me. Then you pick out the chest x-ray, have a quick look. That's it. Just say, so since you have had this cough for a few days now, so do you have any idea what is causing this? There's your ideas done, isn't it? So it's quite straightforward. Any ideas what this can be? Say, I don't know. I've been told that it might be chest infection. So just say, you're quite right. So I think you do have a chest infection. So, but I will need further tests to confirm the diagnosis. These are the tests where you can just set it out. You don't have the. So if it doesn't tell you that it's in the station, they won't give it to you, but you have to still set it anyway. So like Anastasia has rightly say, I'm going to take sputum culture, I'm going to take blood culture and everything else. So in cases like this, if you look at this, for management, initial management, what would you do? Obvious chest x-ray, I'm in pain, doctor. Painkillers, as simple as that. Give some fluids, antibiotics. Done. I'm going to speak to my seniors to see if there's anything else that we can give you. That's it. So it's going to be straightforward. We're not asking too much from you. The PLAB examiners don't expect you to practice as a consultant level. If you are better than the consultant level, you're not going to pass the exams. I've heard of a dermatologist, an IMG dermatologist that failed dermatology stations. Quite ironic, but it did happen before. So just simple management. All right? So I'm going to move on to the second case. Anyone that would like to be a volunteer?
Thank you very much, by the way, and sorry I messed it up. I mean, I thought it was a sim.
No problem at all. You did very well.
Thank you.
No worries.
The second volunteer is Much Samaja.
Hello.
Hello, is it okay if I don't switch on my video?
Yeah, that's fine. That's absolutely fine. So this station, I'm gonna give a prompt. It's not gonna be Simman. It's not gonna be prescribing. It's just gonna be a basic stations. But can you hear us all right?
Yes, can you hear me?
Okay. Yeah, fine. So, like I say just now, the timer is gonna be 1 minute. So it's gonna be enter the stations. Then you will get a prompt at 2 minutes remaining. And then it will say leave the room. So that's the end of the station at 8 minutes. Okay. Are you ready?
Yes, doctor.
Excellent. Let's start.
Begin.
Enter the room.
Hi, I'm Majda Sameja. I'm one of the junior doctors in the department. Can I just confirm your name and age, please?
My name is Colin White. I'm 35-year-old.
Is it okay if I call you Colin?
Yeah, that's fine.
It's a pleasure to meet you, Colin. Tell me, what brings you here today, Colin?
I just don't feel like I'm getting any better, you know.
Oh dear, I'm so sorry to hear that, Colin. Could you tell me what's been going on with you?
Well, my wife left me about 2 months ago, and I've been depressed ever since.
Right. I'm so sorry to hear this, Colin. This must be very difficult on you. How have you been coping since then?
Well, I saw my GP, and he sent me for some CBT treatment, but I don't really think it's doing anything.
And why do you feel that way, Colin, if I may ask?
Because I still feel really low. I don't feel like my mood is still very low. I haven't improved.
Oh dear, you do sound low, Colin. I'm so sorry with what you're going through. Um, Let me ask you a few questions just to get a better understanding on what's going on, and hopefully we can come up with a plan. How does that sound, Colin?
That sounds great, thank you.
Colin, so you mentioned that your GP had prescribed you to see a CBT. Could you tell me more about it? Like, how many times have you visited the sessions?
I think 6 sessions so far.
Okay. Did you visit all sessions or did you skip in between?
I didn't skip any.
Okay, that's good to hear. And could you tell me, was it in a group CBT or was it individual?
It was in a group.
Okay, I see. Okay. And what apart from CBT, were you getting any other treatment at all, Colin?
No, they did talk about maybe some medications, but they thought they would try this first and see how it goes.
Right. Usually that's what we do, but I'm glad that you're here. It's definitely the right thing to do for you coming back. Um, Colin, if I may ask, could you tell me, how is your mood of late?
Low.
I'm sorry to hear that, Colin. Could you tell me on a scale of 1 to 10, 10 being your happiest, where would you scale yourself?
Maybe a 2 or 3.
Oh, that's pretty low, Colin. And how have you been managing?
I've just been sleeping a lot, really.
Oh dear, that must be very difficult. Could you tell me, have you been able to do the things that you like to do?
Not really. I haven't been enjoying him, you know. Kind of lost
Yeah.
interest in everything.
Oh dear. I'm sorry to hear that. Colin, what about your meals? You mentioned that you sleep more. Do you eat at all?
Oh, when I remember.
Could you tell me, are you able to sleep during
I
the
wake up.
night?
No, I wake up really early, you know. It's very strange. I sleep a lot of the days, but then I wake up really early in the morning.
And do you feel refreshed when you wake up?
Never.
Do you feel like you need to go back to sleep again so that maybe you can feel a little bit better?
Well, I feel that, but I can't really go back to sleep. I don't know why I wake up that early. I wake up around 4 or something, and I can't go back to sleep.
Okay, I see. This must be very frustrating for you. Colin, could you tell me, um, when people feel low, some people do have bad thoughts. Um, have you ever thought about taking any things like alcohol just to relieve with your low mood?
And to be fair, I have been drinking quite a bit.
Oh, could you tell me more about the drinking?
Well, I buy lots of bottles online, and I drink a lot throughout the day, and then I sleep.
I see. Oh dear. And what do you drink exactly, Colin?
really. I mean, a lot of vodka mostly, I guess.
Okay, all right. Colin, do you by any chance take any drugs, any illicit drugs?
No.
Okay. Colin, I just want to know, in cases like this, people do have thoughts like harming themselves. Would that be the case for you?
No.
Okay. Do you have any thoughts about harming other people at all?
No.
All right. It's okay. Colin, thank you for opening up to me. This must be quite frustrating for you. And clearly it does seem that the CBT is not working. I just want to know,
Sorry, your voice cut up.
do you have any support at all?
Oh well, I've got some friends, but I don't really feel like seeing them. You know.
I see. What about work?
I'm a plumber, so I don't really have to talk to many people. But I guess with the drinking, it's been a little hard at work.
Have you gone to work recently?
A few times, but I got sent back. I told to take some time off.
All right, all right. Colin, I just want to check your vitals real quick. And also, could you tell me, by any chance, do you think you're losing weight?
Well, I think my pants don't fit as well, so probably.
Okay, all right. I'll check your weight and height, your BMI, and your vitals do look normal. Yeah. I would like to involve my senior because it does seem like it's getting serious at this point. Is that okay if I could have a chat with my son about?
Okay, what do you think they'll do?
So usually I would recommend that we start you on antidepressants. Do you think you're willing to consider that?
I do want to try, I just want to feel better.
Okay, perfect. We'll try that, but I must warn you, they make you a little bit, make you feel a little bit bad, and then till you get better. But it takes at least 2 weeks till you feel better. Are you with me?
When you say they make me feel bad, what exactly does that mean?
I mean, in terms of your mood will still be low for 2 weeks, but
Oh.
I recommend don't stop taking the
Time's up.
medication.
Sorry.
That was really good.
That was really good. How did you think you did?
I feel like I didn't have a
Quite compassionate, Mad.
It does feel like you're very sincere, which is a good thing.
It does.
Yes. It does feel like
she
you
sounded
mean it.
really
So.
low, and no, she did sound very low, and her facial expression, it did seem
I
low.
tried, but you made me laugh.
Yeah. Right. So, how did you think you did in that stations?
I don't know. I don't know.
Okay. So I think you did, like Razaz say, you did very well. In terms of your history taking, I think it's impeccable. I'll give you a 4 out of 4, no doubt at all. You've asked a lot of questions where most psychiatry juniors won't be asking. So I think that's a good start. But if you look back at the prompt again, it says talk to the patients, address his concerns. So in stations like this, if you ask I appreciate that asking a lot of questions is important in the psychiatry stations. But if you don't have time to go into management, it doesn't matter if you get a full score in history taking, but you get 1 or 2 in management. So in these exams, you can get a 3, 3, and 3. In the 3 domains, you get a 9. So that's a pass. So I think it's important to go into management when you feel like you've asked enough questions.
Okay.
So in the psychiatry stations, what I would normally advise is it's about communication skill and history taking, obviously. So you did ask about the social problem, like the family, alcohol, drugs, self-harming. So you did ask about a lot of red flags with compassionate. Excellent. But I would just go through them. Like, you've been drinking alcohol, okay. So move on first. You can always come back and address those problems when you know that you have got time. Otherwise, in these stations, I'm feeling very low, and I have tried a lot of medications. You can always ask. So you know that this CBT didn't help, and you come to us. I appreciate that you come to us today. Are you expecting anything from us? So you can ask them what the expectation is, and
Right.
concerns as well. You can always say, you have had this low mood for quite a while now. Does it concern you, or anything particular that's concerning? So you can always, when he says something, you can always go into, when things like this happen, people have thoughts about harming themselves or harming others. Have you had any thoughts like this? So that's it. It's covered. So I will breathe through the famish, thinking what is more important. But in this case, if you look at the prompt again, address his concerns. So you didn't have time in the end to actually address his concerns. In this station, the concern will be around, I'm gonna start you on antidepressants. The patient's gonna have questions around those medications. So you just have to be ready and spend some time on those things. That's most of the things that people struggle with is time management in clinical, because you have taken such a good history and you realize that you don't have time to go through management. So you will suffer some marks in that, if that
Right.
makes sense.
Yes, it does, doctor.
Yeah. So for interpersonal skill, I would talk in details, in depth in the next sessions or possibly the future session. We don't have too much time. But for those who's having exams sooner, before we go into that, it's just a few sentences in your mind that you have to just remember and find the right time to speak them out. Instead of saying, I'm so sorry to hear that, I'm so sorry to hear that, just a simple, oh, bless you. That sounds difficult. Or just, oh, I'm really sorry. Just simple as that. That's it. You don't have to be, like I said before, I'm going to say it again. If you are not sorry, you don't have to say it. Like, simple. I can only imagine how difficult it is for you. You have to be a good actor in PLAB 2, all I can say. The examiner is going to sit there and think, oh, this candidate is actually all right. He's different from the hundreds other candidates that attend the academy, and the academy tell them, say you're sorry.
Okay.
So a lot of actual juniors doctors like myself practicing the system, we have never said we are sorry. We are not sorry. We're just here to treat you. But we'll go around interpersonal skill in terms of you can say the simplest thing. Like, I had the stations where I was just talking, what's your occupations? They say, I'm an aeronautic engineer. So I actually asked 2 questions around it. So what do you do? Your job sounds interesting. And I got a full marks in that stations for asking non-relevant questions to the station. Because you just have to stand out. There's too many candidates that's done PLAB 2 nowadays. They've gone to the same academy. Everyone's study partner with everyone. So you just have to be authentic. So it's something that we do every day in our life as a junior doctors. They will be expecting you to practice at that level. So a lot of things, if it's in a Breaking Bad news station, you can just stop. In my Breaking Bad news station, I just stop. I don't do anything. I push the tissues towards her, give her the tissues. That's it. I just stop until she start talking. And they are proper good actors and actresses, I would say. They actually cry in the stations. I don't know how to do it for the whole day, but I'm hoping they will get paid enough for that. But they do actually cry. So just be sincere, be what you're going to do when somebody cried in front of you. In stations like this, you don't have to rush to finish it. You take the basic history and spend loads of time addressing the concerns, answering questions. All right. Any questions so far around interpersonal skill that I can just answer immediately? But I will be careful around saying I'm sorry, because I feel like I've done this in my free time a lot, practicing with lots of candidates. What I notice is, and even with my previous study partner, what I notice is, because English is not our first language for most of us, we are not as good as the natives here, where they have got loads of sentences in their bank where they can just pull it out and use it straight away. So what we tend to do is, I'm sorry. So just be very mindful with that when doing the exams. You can always say something, just look passionate, look empathetic. Your body language, you just have to lean forward a little bit. You don't have to touch them. Just lean forward a little bit with your open body language and just tell them slowly, speak slowly, and answer questions. There's something called chuck and check. 2 sentences later, any questions so far? Or they will look confused, they look at you. They will look like they want to interrupt you, but they didn't. They won't, because they have been paid not to interrupt you until you say something. You have to get the cue. So they will be like, so you just say, oh, it seems that you look a bit concerned, or you look a bit confused. Anything that I can do for you, any questions at all? Or you'll be explaining management, for example, in the stations. It's a CBT, so you're going to start them on antidepressant. You just have to explain a little bit more what's important in antidepressant. You have to carry on taking it until you see effect. You can't stop it immediately. So patients will have concerns around that. Will it reduce my libido? So I have to be honest with you, the cases, the concerns are very similar to the scenarios that you get during academy. It's just 1 or 2 questions which they might change, but essentially to maintain the standard of the exams, they're going to be very similar. So you just have to be ready for them and answer the questions. Okay? So are we ready to move on to the next stations?
Yes.
Thank you. Prirana, are you on?
Yes, hi.
Hello. Right. So it's going to be similar, but in this station, it's a Singman station, but we don't have a proper Singman. What I'm going to do is Razaz will be your patient. So I want you to speak to her, but whenever you say something, I will let you know. If you say, I'm going to look at the monitor, the monitor is going to be on the screen. But if you want to say something, you actually do it. I'm not expecting you to finish the 8 minutes, but I just want to run through what's important in Siemens stations. A to E being systematic. That's what we're looking for in these stations tonight. Okay. Right. Let me just get the timer ready. Are you ready?
Yes.
Brilliant.
Begin.
Enter the room.
Prerna Rao, GMC number 365290. Hello,
Hi.
I'm Dr. Rao, one of the junior doctors working in the department. Can I confirm your name, please?
Janine. My name is Janine.
Okay, Janine, I got a call from the nurse saying that you weren't feeling all right. May I know how I can help you?
I've just been feeling really rubbish. I thought I should be getting better, but I'm not.
Okay, all right. Well, I'll see how I can help you with that. Do you want to tell me more about how you're feeling poorly?
I've been feeling really hot. I've been sweating for like the last 24 hours and it hasn't gone anywhere.
Okay, all right. Is there anything else apart from what you've told me?
Well, I'm still, I came here they said I had a UTI.
Okay.
But it still burns. It hasn't
All right.
improved either.
Okay. So I'll just connect you to the monitor and check your vital signs to see what's going on. Okay. Well, since you're speaking to me, your airway is patent, so that's good. There's no, any problems with your breathing, so I'm happy with that as well. And you're talking to me fine, so there's no issues with your consciousness. So I can see that your saturation is a bit low, and I'd like to, give you oxygen to help you breathe better. Do you have a smoker's cough by any chance?
No, I've never smoked.
Okay, all right, that's good to know. So I'm just gonna give you oxygen via non-rebreather mask up to 15 liters per minute. So you're just gonna feel a gush of air once I put the mask over your face, and I just like you to relax and just breathe normally. Is that okay?
Yeah, that's fine.
Okay. So I'm gonna check the monitor in a few minutes again to see if your breathing has improved, and I see that your respiratory rate is 25. So I'm gonna assess both of these things later to see if there is any sort of improvement. So now I'd just like to examine your face to see if there's any sort of cyanosis or nasal flaring. I'm just going to touch your neck as well to see your trachea is if I know everything's all right with your neck and if your trachea is central. And I'm going to listen to your chest and lungs as well to see if I can hear anything which is not very normal. And I'm also going to look and tap on your chest to see if there are any skin changes or and I'll also see if your chest is expanding properly and to assess the symmetry of your chest wall movements and and also tap on your chest to check for any dullness, resonance, or hyperresonance. Okay. All right. So I'd like to see, and I'd like to listen to your lungs to see if your breathing is normal.
So breathing is equal air entry bilaterally. You can hear a little bit of crackers on the right side.
Okay. All right. Well, I do hear a bit of abnormality on your right side, but I'd just like to reassess the monitor again to see if there was any improvements in your oxygen saturation or your respiratory rate.
Patient's breathing more comfortably now. Saturation's gone up to 96% on 15 liters.
Okay, all right. So I'd like to. I see that your BP. I see that your blood pressure and your heart rate. Blood pressure is on the lower side, and your heart rate is a bit high as well. So I'd like to insert 2 large bore IV cannulas.
What colors are they?
Into your gray. So I'm just going to insert these 2 needles into your arm, and you may feel a bit of a discomfort, and if you feel any pinch, that's okay. And I'll just try to be as quick as possible.
Carry on.
May I proceed with that? Okay. So I've inserted 2 large bore cannulas. So at this point, I'm going to take certain bloods as well, including a full blood count, inflammatory markers like CRP, ESR. Also, I'm going to do ABG, and that would include TROPS, lactate, okay. And also I'm going to do, since there was urinary symptoms, I'm going to, check take a urinary sample as well, and blood culture and urinary culture as well. Okay. Since your BP is low, I'd like to give you some fluids, if that's okay.
What fluids? How much?
I would like to give Hartmann's. I'd like to give Hartmann's, I think 1 liter.
2 minutes remaining.
So, yeah, 1 liter. Okay. So I'm going to also, reassess the monitors to see if there've been, in a few minutes, to see if there've been improvements in the heart rate, in the blood pressure, if it's come up. So I'm just going to examine you a bit more, listen to your chest to check if there are any signs of pallor, to check the peripheral pulses as well, our cold extremities.
So, cold extremities, warm peripherally, no pallor, warm, well perfused, cap refill 4 seconds.
Okay, all right. So, I'm happy with the circulation. I'd like to check the monitor again to reassess the blood pressure.
Blood pressures come out quite nicely to 100 to 80.
Okay, all right. Since the patient was speaking to me, there was no sort of neurological deficits. So I'm going to perhaps chase to see if any of the investigations have come up, like the ABG results, if they've come back.
They're still waiting.
Okay, all right. So, now I'd like to just expose you to see if, and if there's a catheter inserted, to check the catheter as well. So I'd just like to expose you. I'd have a chaperone with me to ensure your privacy. I'd like to expose you from head to toe and to check for any signs, any rashes or anything that I've missed so far, and check the catheter as well to see if there's any blood in it or if there's
no catheter.
Okay, all right. So at this point, I would like to.
Time's up.
Oh my god.
Well done.
I think you did very well. It's not the easiest station of all, and practicing like this is not ideal, I know, but you just have to program your mind systematically. If you go into the stations A to E, most people won't finish the station. So if you can finish the station with a diagnosis, you're going to walk out of the stations knowing that you pass. Because there are not many scenarios around SIMMEN. There are about 8 to 10, and they're going to keep repeating. So what you need to when you look at the prompt, you know that it might be a SIMMEN stations. If you're at Hartmann Square, there's a little window where you can just have a little peek around, and you'll see somebody lying there. So you know it's a SIMMEN station. Just a little tips around that. If you once you walk into stations, you just look around. Just calm your mind down, look around to see if there's any drug charts on top of the crash trolley, to look at the patients. And then you walk to the patients. You did very well. So you started introduction. So you know what you're going to ask the patients. That I'm going to be here to help you. What I would suggest to do is it's got different pattern, but I think a more systematic way and more time-saving way of asking question is ask while you do it. I'm not saying that if you can ask the question, take the history first, and then you do the examinations. It's not wrong. But sometimes you tend to forget the time, and while you're asking, you forgot that you have to assess them. These stations assess how you manage patients acutely. So you go into them, take your history. Hi, my name is Dennis, I'm one of the junior doctors here. Can I just check your name and age? Or just look at the wristband. If he's not answering, but he's gonna be, some of them is gonna they are really good. So I'm just gonna check your name and your age quickly. Just look at the wristband. And don't worry, I'm here to help you. So if the patient, I'm not well, doctor. Since you're talking to me, your airway is patent. I'm happy with that. Move on. Airway is always the most important. It's something that I would check immediately. Because if you are taking history, airway collapse, you're too late. So it's something junior doctors do every day in real life, assessing the acutely unwell patients. Go in, check the airway. Patient, since you're talking to me, your airway is patent. So let me just have a quick look at the monitor. So you go straight into B, nothing else. So I can see that you're struggling with breathing, John, or Janine in this case, Janine. Your saturation is a bit low. I'm gonna give you some oxygen. Can I just check if you're a smoker? I'm not a smoker, doctor. So just start, actually take the thing from the crash trolley, put it on them. Examiner sometimes will ask you how much oxygen you want. You can just tune it out to 15 liters via non-rebreather mask. Majority of the case, I would say, majority of the case, you need to give 15 liters. You need to know where they are. In terms of the crash trolley, it's A, B, C, D, E. So it follows. If you are systematic, you follow every single drawers, you'll know where you find the things. So put the oxygen on. Look at the monitor again. Let me just have a quick. So you can just ask, so what brought you into the hospital? I heard you're a bit unwell. Tell me a little bit more. So you don't have to say, the nurse has called me. Just say, I heard that you're a little bit unwell. Tell me a little bit more. So he will tell you, I've been admitted to the hospital with UTI, but I'm not well. I'm feeling poorly. Don't worry, I'm here to help you. That's your interpersonal skill. Then you carry on what you want to do. Let me have a quick feel of your chest. Always talk to the patients. Remind them what you're going to do. Have a feel of your chest. Just going to tap on it. Have a quick listen. So if you listen, do exactly what you're going to do in real life, because they will look at them. Just not say, I'm going to have a listen. Take the stethoscope, put it in your ear, start auscultating. Because the seamen, you've paid so much money, so it only makes sense for them to spend some money on the seamen. The seamen is actually real. You can hear wheeze, you can hear crackers, whatever that they want you to hear. And they're going to be easy case because they're very prominent. The signs are very prominent. So you're going to do what you want. ABG, I'm going to request a portable X-ray for you. They will just come. You just said it. You don't have to wait for it. Just say, I'm going to request a portable X-ray for you. I'm going to do ABG. And then you move on. Before you move on, look at the monitor again. You're saturating a bit better now, Janine. And I can see that you're breathing more comfortably, so I'm going to move on. So the examiner know your trend of thoughts in the mind. You move on to C. Let me have a quick look at the monitor again. Oh, Janine, your blood pressure is a bit low. I need to give you some fluids. You see the sign, you manage it straight away. You see the sign, you manage it straight away. So I can see that your blood pressure is a bit low. I'm going to assess you quickly. You can do, so it's just a few things you need to do. Listen to the heart, cap refill. So you don't have to do a lot of extra things because you don't have time. I'm going to pop 2 cannula in you, and you just have to pick it up. It's orange or gray. You have to actually pick it up, put it on the patient. The examiner will tell you, fine, carry on. So what fluids you want to give? Low blood pressure, bolus. You have to pick the fluids up. I'm going to give you 250 ml or 500 ml bolus as soon as possible. Or if the patient is not acutely, if it's not hypotensive, I can give you some fluids maintenance over 8 hours. You have to actually go in the drawer. Sometimes they will put it on top of the drawer. Just grab it, pop it on the bed. And then if you're happy with C, move on. Your heart rate is fine. Heart rate will come down eventually. It's fine. Move on. D. Patients talking to me. Alert GCS of 15. Quite happy with that. Carry on. I'm going to take out the torch, shine into the lights, equal pupillary reflex. Fine. Move on. So you don't waste any single seconds in the stations. You just go in, manage the patients, get out. So I'll do a quick BM on you as well. That's it. Nothing extra. So move on to E. Move on to E because you need to spend some time on management. You move on to E. Let me just expose you quickly. And check for any bruises. There is a bleeding case. There will be a lot of bruises on the tummy. So check for rash. Just a few basic things. I'm just going to expose you and I'll get a chaperone. I'm going to expose you just to check. So you look through them. Fine. I'm happy. Go back again. So by the time you say, okay, I'm suspecting that you might have a blood infection or sepsis, then you start with your management. I'm going to check lactate. I'm going to check. So when you say you're taking some bloods, what bloods are you going to take? In that one is in C. So I'm going to take your blood, FBC. These are the things where you can actually memorize because they're going to be the same in every case. I'm not asking you guys to memorize the script, but it's just to memorize what you're going to do. I'm going to do FBC, check your kidney function, check how your kidneys function, your livers function. I will take blood culture if it's spiking fever. I will do a procalcitonin, and they'll be impressed. The examiner will be like, oh, this is different. And I will do a quad swab with spiking temperature if you want. So you move on. So just manage C, move on, manage D, move on, manage E, move on. And then you start talking to the patients. Since the patient will decide, if you look at the monitor at the end of your assessment, you will find that, oh, this patient's vital is actually improving. Because once you manage them, they will just change the vital state straight away. So you say, oh, it's improving. So what do you think you have? Just, you can start explaining now so you can get interpersonal skill marks in. So what do you think you have? So I think you might have you have sepsis or blood infection. So what I'm going to do, I'm just going to wait for the bloods to come back so you know that takes free, gives free. And I have given you this and this and this. I'm going to put a catheter in. So normally they wouldn't expect you to actually put a catheter. I'm going to put a catheter in just to measure your urine output. So leave the management at the end. I'm going to give you some antibiotics as well. So if you are keen, you can say, I'm give you some IV of amoxiclav. But A to E assessment is the thing that they assess you on, that they want you to do it on the patient. The rest of the things are extra. So you can get those extra points in. But if you can pass, if you want to pass, you do A to E well, stabilize the patients, that's good enough. And then you can always say to them, I'm going to speak to my senior. I'm going to get my senior to come and see you again. Or you can say something extra at the end. I'm going to get some ECG. You can say it in C. If you forget, doesn't matter. You can always say it in the end. So in terms of A to E, always remember, go in, start with A, B, C, D, E. Start taking history from B. If you want, you can take a quick history in the beginning. That's fine. No one's stopping you. You can take a quick, I'm feeling unwell. I've been admitted 3 days ago. So any past medical history, or sometimes there's a drug chart lying on top of the crash trolley. I'm just going to have a quick look at your drug chart. Or in the asthma case, you will see inhalers lying on top. So in nebulizer, I just say, I'm going to give you, in B, I'm going to start manage you straight away. You sound a bit wheezy, Janine. I'm going to give you some naps. How much do you want to give? 5 milligrams salbutamol nebulizers. They've got vial in there. So you can look at them, know the trolley. So if you're at your academy, what you could do is go through Siemens stations by looking at the trolley. See what's in there, where you're going to find your stuff. Any questions so far? You can inform your seniors, but it depends on what kind of case. If you feel like it's something that you're unsure of, but in Siemens case, I would say always inform your seniors. Because if you look at the news score that's been used in the UK, if they're news of 7 and above, they need to get a registrar to review them anyway, but you need to do the basic management. I'm going to hand you over to the senior. That's it. So it sounds a bit daunting, but if you keep practicing, you will eventually get used to it. And during the exams, you'll be less nervous, because nerve is the thing that would actually make you struggle during the exams. I think we've got about 6 minutes. So any questions? So I have got this. Let me just share it to you. I have made this for myself during my exams. Oh, sorry. Let me just show you. I have got this flashcard that I can share with you guys. It's not a Bible for PLAB 2. I'm not saying it's a Bible for PLAB 2, just a disclaimer, but I think it's a really good a flashcard for you to refresh your mind before your exam. So it's got all the basic stations, all the stations that commonly come out with basic clinical management, especially if you are nervous. So let me just show you. It's something like this. So I've got chest pain, DDS, what's important, what you need to ask. So if you want them, it would be much appreciated if you could give us some feedback. Once you've done the feedback, I can email them to you. So I think we've got emails of those of you that joined the session. So I hope these sessions actually help, even at the slightest, tiniest bit. Thank you everyone for attending. I think we'll aim to have this kind of sessions every 2 weeks. And I will go through every single bits like prescribing, interpersonal skill, or drug counseling, teaching stations. So we'll go through them. I do apologize for those of you who have exam earlier, but we're doing it once every 2 weeks. So if you're interested, there's a link where we can sign up. Razaz, do you know if we have got their email address or?
The people who have signed in, then if people can just put their email address, I think in the comment section, at least everyone will be there.
Okay, so anyone who's interested in the flashcards that I made, and we've got, if there's any updates, I'm always happy to send out an email just to let you know. But we'll be doing this kind of sessions every 2 weeks. Anything else that from yourself, Razaz?
No, I think that's it. Thank you, everyone.
Thank you, everyone, for attending. And I hope you have a good one. And good luck for those who's having exams soon.
Okay, I'm just going to leave it open and wait for everybody's emails to come through. But feel free to leave, guys.
All right.
Once you've done that.
Thank you very much, guys. Cheers.